All right. Well, I think we will go ahead and get started. I see we've got over 120 folks already logged on, and several more I know joining as we speak. So this is thrilling. Just want to start off by saying thank you all for joining us today. It's great to see so many folks logged in, and obviously this is a topic with a lot of interest across Minnesota. My name is Jake Loesch. I'm the executive director of the Citizens League, and we're so proud to be working alongside the Center for Rural Policy Development on this interconnected series. We've been doing these conversations for a couple years now, and I think really helping bridge that urban-rural divide and bring people together to talk about really important topics like this, like childcare today. For those of you who aren't familiar, Citizens League is a nonpartisan, nonprofit organization. We've been working in Minnesota for more than 70 years, and we focus really on empowering people to engage in civic life and to be active in the policymaking process. We do that work through study committees and public policy research that brings people with different viewpoints and perspectives together to develop pragmatic solutions for policy challenges. We also run our Capital Pathways internship program, unique program, one of its kind, that's a paid internship experience for BIPOC college students to engage directly with advocacy in the legislative process. And finally, we convene events and conversations, just like today, with partner organizations like CRPD. I'm really excited to dig in and hear from our panelists today. And with that, I'm going to hand it over to Julie at CRPD to give an introduction and get us started. Thank you.
Thanks so much, Jake. Yes, it is afternoon. Good afternoon, everyone. Glad that you're here today. I know people are still joining. We have over 350 people registered for this webinar. So obviously this is a very important topic. Like Jake said, my name is Julie Tesh, and I'm the president and CEO of the Center for Rural Policy and Development. We were created in 1997 to specifically look at policy with a rural lens. And so we've gone from being a white paper organization more into targeted research. We like to say we can provide the color commentary on policy and on research. And so when we're looking at childcare, our organization was one of the first ones, if not the first one, to have a thorough report about rural childcare. And then we started working on what does urban childcare look like. And through this whole part of interconnected, like Jake said, we have so many commonalities. You know, you hear all around about the rural urban divide, and that may or may not be, but the issues that we do share so many issues together. We all want great childcare, great schools, great healthcare, great transportation. It's just that the solutions may look different. And so that's where this interconnected comes in, where hopefully we can learn from one another and find out what are those differences that we're looking at, but work for the common good. And so I will just mention that all of our research reports are online and free for you to access at ruralmn.org. And you can also sign up for our newsletter list as well. And that will make sure that you get your invitations to the upcoming Interconnected series, and then also for our future webinars. Most of our research reports have an associated webinar with it so that you can use that information. And with that, we're going to get right into the heart of it. And I am happy to introduce Marnie Werner, our VP of Research and Operations. And she is going to kick today off with our research report. And I will also mention one housekeeping thing. You'll see in the chat, feel free to ask questions. We will be keeping track and answering those questions. So if you would like to ask a question or make a comment, please go into the chat. And then you can also use the Q&A tab as well. So Marnie, I'll turn it over to you.
Okay, thanks, Julie, and good afternoon, everyone. I'm gonna get my screen shared here. And I should mention too that often with these, especially our webinars on childcare, people really like to discuss with each other in the chat. So feel free to do that too. We don't mind if there's little side conversations going on. And so, yeah, today we're going to talk about childcare in rural Minnesota and the solutions around it and everything. I'm just going to quickly do basically a refresher on it. So this is our About Us slide that Julie already covered most of this. But yeah, we're a nonpartisan, nonprofit policy research organizations. And here's a quick refresher on where we're at with childcare in Minnesota. So this is since the end of 1999, and this graph is broken out by population density. So basically, the year end 1999 to year end 2022. And we have the different population density groupings that we use. We group counties by population density using a pattern that was developed by the state demographic office. And so this is for total capacity, both family childcare and center childcare. And here you can see the darker green line is the entirely rural. The lighter green line is the town-rural mix. The lighter brown, urban town-rural mix. So we're getting a little denser in population. Here is entirely urban greater Minnesota. So this would be, say, your Mankato, Duluth, Rochester, your bigger cities and their counties. And then this very dark brown line here is entirely urban Twin Cities. So this is the 7-county Twin Cities area. And then red is Minnesota. And so what you can see is that for the 7-county metro, the development in total capacity stayed pretty flat. In fact, it was low compared to 1999, and it stayed relatively flat, and it's still at about the level that it was at in 1999. Entirely urban greater Minnesota was doing pretty good until it just kind of went off a cliff there. But in the meantime, greater Minnesota has been kind of just gradually falling. And so here's the same, oh, this is the same chart in a slightly bigger size. So you can get, it's just the same thing again. And now here it's broken out by family childcare, which is your in-home childcare, what we think of as our in-home childcare, and then center childcare on the right. And so you can see that family childcare has been declining steadily for all of these groups. Some started sooner than others, but they're just all on the decline. The state average, the state in general has lost half of its family childcare capacity since 1999. And center capacity has been growing fairly steadily for all of these groups, except in entirely rural Minnesota until about 2016, 2017, when it really started to kind of take off there. So that's a good sign. And then when you talk about centers in rural areas, what we've talked about all along that we've kind of discovered early on was that centers have a harder time growing just organically in places with less dense population. Growth in centers really depends a lot on population density. And so growth in entirely rural counties has not been able to make up for the loss in family childcare. And you can see that in the left-hand graph that's are entirely rural counties. Whereas in the entirely urban counties, you can see that center care here in red has kept total capacity fairly stable there, even as family child care has leveled off. And so the big issue now, when we started this, the big issue was, yeah, there's just people are having a hard time finding places to put their kids. But it quickly developed into this is a problem that's interfering with business and with our local economies. Employers are having a hard time finding workers. And so the plain fact of it, according to the data, which we've been, tracking for 20 years, we have a people shortage. Baby boomers are retiring. People have not been having as many kids or not having kids at all. People are leaving the state. And then people are also opting out of work to a certain extent. And all of this adds up to us having a definite people shortage. This was a graph that we put together around the first time we put it together around 2022 to show how the shutdown during the pandemic and the issue with childcare then really affected women more so than men. And so the red line is the female population, and this is indexed back to 2012. And so you can see in all parts of the state, um, the employment for men and women dropped off with the pandemic, of course, because everything shut down. But women were slower to get back into the workforce, except in Southeast Minnesota, which of course is Rochester, where it's a lot of medical and healthcare, and in the metro area. And so you can see that the female workforce has recovered since 2012 in just those two regions. It's still below 2012 in the other regions. And in fact, a side note too is that the male side of the workforce hasn't recovered either. And that's an interesting phenomenon that we need to look into further, because that is something that is popping up elsewhere too in our work on workforce. And so does a childcare shortage hurt the local economy? Economic developers around the state say it does. We did a survey of Minnesota economic developers and local officials in 2021. And except for in Southwest Minnesota, over 80% of the respondents said the childcare shortage was serious or severe. And then lack of childcare hinders recruitment. 75% of respondents, over 75%, said they hear from employers at least once a month about childcare being a barrier to attracting and keeping workers. And in some regions, they were hearing multiple times a week from employers. And part of this problem is workforce and competing for this shrinking share of workers, especially for centers. Finding workers is their top problem. And that's because childcare workers are opting for jobs with higher wages that are less stressful and don't require as much training and probably offer benefits or maybe other benefits. You can see in this chart here, this is the change in median wages for job vacancies. So these are vacant jobs. And you can see how employers have been having to raise the wages over the years to try and attract people into them. And the average pay for childcare workers in the last several years has been very much in this range, or maybe a little above this range, but it's been staying very lockstep with a lot of jobs that don't require as much training. And so it's creating a lot of competition for centers. And then in family providers for them, some of them are opting out too, just because they go and get these other jobs that don't require the long hours, the stress, and the wear and tear on their homes. And so what do we do about this? We start looking at it as people-centered economic development. Over the years, we have thought about economic development as attracting more businesses to a place. And now we have to do a complete about face and stop thinking about business recruitment and start thinking about people recruitment. And childcare and housing are two of the big things that are interfering with people recruitment, especially in rural communities. And so that's a new way of thinking about it. And so here's what communities around Minnesota are doing about their childcare. And we gathered most of these in 2022, and we know there have been more since 2023. And just from, top level down, direct and indirect giving for both types of providers, community coalitions, pods for family, childcare, and I'll go into more of these a little bit in detail. Public schools stepping in, educating the community on the importance of childcare, Spanish language training in multicultural settings, and employers participating in the solution. So some of the examples we have are projects reflecting a variety of ways to approach the problem. So some places like Swift County are offering direct grants. Places are directly subsidizing providers through loans and grants. Subsidizing by paying for things directly, like training and licensing. The Initiative Foundation is helping with education, helping pay for education for people to become qualified childcare professionals. It can be something even smaller, like Brown County opted to just not charge providers a fee for their licensing or relicensing. And we may think, oh, that's not a big deal. But for providers who are just trying to, control their expenses, that's a big deal that helps. And the goals are to try and lower the cost of entry and or operation for providers. And then approaches to the problem are more examples. Community coalitions. We had some in Duluth, in Meeker County, the city of Worthington, Nobles County, and the school district, ISD 518, had a coalition together. School districts, Cass and Mantorville School District, added infant and toddler child care program to go with their existing preschool program. When they opened that in 2020, they opened that for 7 infants and 14 toddlers. And they were already working on an expansion when they opened because their wait list at the time was 130 kids. So you can see the demand there. And then 2 examples of employers as providers. Hormel Foods is opening their center soon. And then CCM Health in Montevideo also has a center. And then examples of pod facilities, and these have been gaining a lot of attention over the last few years. This is where you have a family child care license and you have providers, a number of providers, maybe 4 in one building, but they're all operating as separate family child care facilities. And so they're allowed to do this as long as they're not, commingling the kids or, sharing things, but they can share the cost of the building, the rent, they can share the cost of the utilities and things like that. So, and it's not in their home. And so it really makes a difference for them. And then public outreach campaigns explaining why childcare is important to the local economy and the community overall. Redwood County and Candy Ojai County have been doing that. And so then our advice to communities is to, first of all, know that there is no easy fix. There's no silver bullet. I say this every time, but I think it bears repeating. There is no one size fits all solution. And so you really have to address this as a community, local officials, employers, providers, families, organizations all come together and get involved, figure out what their community's childcare needs are. And that's the next one. It won't be the same as the town next door. So you have to figure it out for your community. And then treat childcare development as an investment. And then show appreciation for your providers, because feeling unimportant and unappreciated is a big factor in providers quitting. And it may sound like a little thing, but it actually makes a big difference for providers. And so that is my presentation, and I will turn it over now to Kate Raditz, who will be introducing our panel.
Thank you, Marnie, and good afternoon, everyone. Very excited to be here. As Marnie mentioned, I'm Kate Raditz. I'm the Director of Public Relations and Communications for Park Street PR, and I will be your moderator today for this discussion. Very excited about this interconnected series, a collaboration from the Center for Rural Policy and Development, along with Citizens League. And this issue today, it's so exciting to see so many people interested, because it's a critical issue of what is a crisis, not only in Minnesota, but in America on childcare. We have some great panelists to give their perspectives and expertise. Before I introduce them, just another reminder that this is being recorded. Also for viewers, people turning in, if you have a question for the panelists, feel free to put that in the chat box, and I will try to pause throughout the questions that I have and take those or some of them to see if they are able to answer those as well. And if there's a member of the media on that has a question, it would be great if you could say who you are and your outlet along with your question. So I'm going to introduce our panelists today. Panelists, it would be great if you could have your video cameras turned on so I can make sure everyone can see you. First, we have Jessica Beyer, Associate Minnesota Director at First Children's Finance. Tiki Brown, Assistant Commissioner for Children and Family Services at the Minnesota Department of Human Services. Marla Fountain, Director of Living Word Child Care Center in Minneapolis. Larry Hosch, Office of Inspector General Licensing Division in the Minnesota Department of Human Services. And Sherry Teagues of Sherry Teagues Family Child Care in Morris, Minnesota. So I am going to jump right in. I have prepared some questions. I would like to start with Marla and Sherry, who work in childcare spaces, a little bit different, one at a center, one in family childcare. But if both of you, maybe we can start with you, Sherry, tell a little bit about who you are, your childcare story, and talk about the challenges that you are seeing today and the challenges you have been seeing over the last few years.
Hi, everyone. I'm Sherry Teagues. My program and I live in West Central Minnesota, on the close to the border of South Dakota and North Dakota in Stevens County. I have a background in early childhood that goes more than 30 years. It's blink of an eye and it went by. But I started out in capital marketing and finance, and my husband got a job in Morris in law enforcement. And so we kind of grew up in this area. But when we moved here, there was no job. There was nothing here for me that would help me make a transition, lateral transition. So I got started in childcare at that time because we had an infant. We couldn't find anything open at that time. And so I started a program then. I worked in ECFE. I've worked in preschools. Then I went to child care center. I was a director there for a while. I was lead teacher for different age groups. And then I went to family child care in my now home in my current program. So I kind of feel like I've dipped my toe in a lot of different areas, but I found out it's my true passion. And I really do love working with children and families. It matched everything and it lit a fire in me that has stayed. So I've been lucky in that aspect of the program. I also am an approved trainer for MNCPD, so I can do training for early childhood educators in Minnesota, which connects me to a lot of programs. I hear a lot of stories. I hear a lot of successes and challenges. And so some of and I don't speak for every program in the state. You speak to a different family child care provider, and they're going to tell you that there are different challenges in different communities and different cultures. With family childcare right now, it's kind of, we have got, remember we had around 9,000 providers. And today, when I looked at the number, we're at 6,037 active family child care licenses. So it's concerning because rural Minnesota relies heavily on family child care. They rely heavily on center care too. I'm not saying that, but there are communities without a center. And so we need to think about the challenges and why this is happening. And it's unique everywhere, why that can happen. There's a need for, and I want to call it trusted or consistent resources for different family childcare programs that are consistent with their cultural background. Do they speak their home language? Do they understand the needs of families in that community, because that affects that family childcare program? So that's, unique in each community too. The balance of business and professional. I cannot tell you the number of times when providers are talking to each other and they're saying, I have this problem and I have that problem. And then we have to remind each other that it's business, it's not personal. Remember, you take on your family's issues. You love nurture their children, you're teaching them, you're helping them through their milestones. But in the grand scheme of things, it's business, and you need to remember that part of it. It doesn't take the personal out, but you need to remember that perspective too. Parenting has changed since COVID has been happened. it feels like there's different expectations and the cultural dynamic has changed. And so making those adjustments so that you're meeting the needs of the children and the families, as well as building quality in your program, is a challenge. There's a housing shortage for family childcare, which is the beautiful part of the special license, or what some people are affectionately calling it the pod model, which is very unique. Licensing has been very helpful in building different and unique opportunities for family childcare to expand outside of their home. You know, I'm grateful for that because Stevens County has really benefited from that. Graduates coming out of early childhood programs are not coming back to rural communities. They are looking for programs in communities where they feel safe, that their programs are going to grow. The how can I say it? The verbiage, or however you want to look at it, that's being talked about right now is there's a shortage of childcare, that parents can't afford childcare, and that you can't make a living wage at it, makes people go, gee, do I want to start a business? Is this something that we can do? My message to everybody is yes, you can do it. You can do it. There are resources out there. There's, you know, you'll talk to Jessica about that too with First Children's Finance. But, you know, Tom Copeland, Heather Newville have been very instrumental in helping family childcare do the business side. We need the health and safety training, but we need the business side. I'm almost done. I want to say there's a lack of people coming into the program. It looks like centers are growing, and they are, but is that center that's getting licensed providing childcare? Or is it a preschool that's getting licensed as a center that the people in that program need wraparound care? I'm curious to what those numbers are because those are two different programs, but it's vital. It's important. We're filling a need for those children. So, but there is a difference there, and you need to think about that wraparound care. Food costs and business costs have skyrocketed. And I cannot raise my rate 68% and have families say, oh, no problem, we can pay that. They can't, because their costs have also gone up that. So how do I mitigate that? How do I balance what I have to stay open and be able to put food on my table and you know, create a quality program and a safe place for kids? And then there is a lack of preschoolers right now. That is the age group that family child care makes money on, that helps you sustain your business. I don't know if it's a birth rate thing. It could be. But those are just a few challenges that I can kind of think of. I just want to say that the resources aspect, I was part of a group with Jess Roberts in the University of Minnesota, and we were working on building those resources for existing programs, for new programs. And then Wayfinder was built, valuable program, needs to be there, supporting new people coming in. But now we need something soon for existing providers. And I would say anybody who's looking for a pathway to that, connect with Jess. A lot of work has been done. And I think you could use some of that to build whatever it is that goes forward. Okay, that was a lot to take in, but that's, you know, that's what I see.
Thanks, Sherry. Marla, why don't you tell us a little bit about your center and what are the biggest challenges that you face in your day-to-day work there? Oh, and Marla, you're on mute, but yep, that's okay. There you go.
Hi, my name is Marla, and I work at the Living Word Child Care Center. We have been in existence for 2 years. And my biggest challenge is staffing. Keeping staff and staff calling off. Right now, that's the biggest challenge. And then another challenge is finding infants. Our infant room, I only have one infant right now. So the other rooms are doing well. But right now we need infants to come in. Those are my two biggest challenges.
Marla, what does your day, what happens in your morning if someone calls in sick? What does that involve for you if someone on your staff calls in sick?
It involves me jumping in and doing their job, which I love engaging with the kids. That was my first job, teaching in the classroom. So I really love engaging with the kids. That just happened yesterday, as a matter of fact. And we had a great time together.
Thanks so much, Marla. Thank you. A couple of questions for Assistant Commissioner Brown and Larry Hosh. Can you explain, and feel free, anyone can chime in, but can you explain, just so people get a sense of where Minnesota stands, what's the average cost? I know it varies by age, but let's talk about an infant. What is the average cost of childcare for a full-time infant in Minnesota? And how does that compare in terms of childcare costs in the rest of the country?
Larry, I'm happy to hop in on this question. Hi, everybody. Tiki Brown, Assistant Commissioner for Children and Family Services. Thanks so much for this conversation, and really helpful to hear also from Sherry and Marla. So just excited about the different folks and perspectives that we have today on this panel. So I'll give you a little bit of data here. So apologies for that. But so according to some 2021 childcare aware data, Minnesota families are paying about $17,000 for center-based care and about $12,500 for family childcare. We've also have information from Think Small, which is one of Minnesota's childcare nonprofit partners, who has shared that a Minnesota family with one infant spends about 21% of their household income on childcare. So obviously a lot of funding. And we rank, as we look across the nation, as fourth most expensive in terms of our childcare costs. Which is shocking, right? We have a really high, and there's a number of reasons for that we suspect. Some of it is around cost of living. Some of it is around some of our licensing ratios. But for probably a myriad of reasons, we do rank as one of the more expensive states in terms of our childcare costs. Larry, I don't know if you want to add anything to that.
No, you covered it well, Tiki.
Larry, maybe you can explain, what is a child care desert, and do we have this at all in parts of Minnesota?
Well, I'd like to go back to a little bit of what Marnie presented on with the decline that we're seeing with family child care providers. That's a reality for Minnesota, and it's a reality on the national level. Even pre-pandemic, for instance, from 2003 or 2005 to 2017, on a national level, we saw a decline of about 48% of family child care. And that is disproportionate in greater Minnesota. The family child care model is usually 12 children or less. So the economies of scale make a lot more sense in the greater Minnesota settings versus center-based models. So we haven't done an analysis specifically by zip code or county to see if there's childcare availability deserts, or doing a radius analysis of how far it takes to travel to an opening for childcare. But we do know the national trends that we're experiencing. And we have commissioned a report in which we worked with Wilder Research and presented to the legislature in 2022 to explore some different licensing models. Most states, including Minnesota, really adhere to the child care center model and the family child care model. Two very distinct and unique different models. And one of the areas that came out of the report was the suggestion to explore a mid-sized child care model, where we can get greater capacity over the 12 that we see in family child care, but maybe you don't have the economies of scale in greater Minnesota like that would support a full-fledged child care center. So can you mix age groups? Can you have different settings that would be conducive to another model? That report I will throw into the chat. but that is one area that we've experienced, some policy contemplation for pursuing. But our childcare industry is going through substantial changes right now, and trying to absorb more changes might be difficult. We're looking at new systems that every childcare provider is going to have to deal with. We're looking at all the programs that Tiki's administration is administering right now. We are moving to a new Department of Children, Youth, and Families. So all this change is substantive, and additional changes, we need to consider other policy proposals, but it needs to be a collaborative process with all of our partners.
Thank you. And I just wanted to make note of a couple comments, because a couple people were commenting on Marla. Marla, you saying you were you were having trouble placing some infants. I did want to come back to a couple of comments from people saying, I find it interesting. I own a center. We have a wait list for infants that's out almost through 2025. Someone else said, I also find the infant openings interesting. That's our largest need in rural MN. And I just want to mention that, because I know in the research I've done on this topic over the years, we have heard this from many centers. And so maybe Sherry, are you able to comment on that at all? What you have seen in terms of, have you had problems with placing infants, or is that something more of a problem in rural Minnesota that you've heard? Because I know here in the Twin Cities, definitely have heard from other parents that sometimes can be, a year or more wait list for some centers.
What comes to mind right away when I heard Marla say that was that each situation is a product of the culture that lives in that community. So maybe in Marla's community, when babies are born, it is part of their culture to stay home with their babies and not work. So we need to always consider what those cultural norms are, what that looks like in the community. For me, I have 30 kids on my waiting list, and infants and toddlers, from the day I started back in when I first got licensed in family childcare in 1998, when the dinosaurs were alive, I couldn't get infants in. I mean, it's like you can only have a certain number, which I agree with. There's a safety part of it, health and safety issue that where you need, they need love, they need attention, they need attachment. And so I hear family childcare providers say, I'm supposed to be able to take 2 infants, but it depends on who you have in your program. I may only be able to take 1. Right now, maybe somebody has a child in their program that has a special need that requires a lot of attention, and they know ethically and responsibly that taking an infant would not benefit their program. So, and then waiting lists. I just want to quickly talk about waiting lists. You can get somebody on a waiting list, and I take a waiting list, but just because you're number 1 on my list doesn't mean you're the first one coming in when I have that opening, because you might not fit the hole that I have. If you're in my program and you get pregnant, you get my first infant spot because you're already there. The waiting list has nothing to do with it. So it's kind of sticky and icky and hard to figure out. You try to do it in an ethical way. But yeah, infants can be, it's hard to find infant care, but it's going to depend on your cultural community and how it goes. So it's a unique, I don't know if that answered your question, Kate, or not, but that's kind of where I see it.
Yeah, no, definitely. I just wanted to point that out, since I know so many people are weighing in on their challenges of placing infants. And so I wanted to just make sure I acknowledge that is a real challenge for many providers. Coming back to a little bit about the cost of infant care, we hear how many families are struggling. I think you said more than 20% or 20% of their income for childcare. Jessica, if you could maybe explain why is it so expensive? Especially, okay, we'll talk about infant care, but why is childcare so expensive? I think parents often wonder, how does it all add up?
It's really easy to count heads, and it's a if you're in a childcare center, you pay your bill and you're like, oh, I know how much my infant costs. I know how much my toddler costs, and count heads and being like, well, you're making pretty decent income, right? You're making about, same with family childcare too. You can count heads and be like, well, you're making about $75,000. That's a pretty decent income, or whatever the center is when you do that calculation. It is a very high operational expensive business to run, and it's very unique and very challenging on the business side to maintain that profitability. A little minor swing can have a huge impact on your bottom line. So if a family moves and you're struggling to fill those spots, or if you have some teachers that leave, so now you don't have the staff to teacher ratio, so now you're not able to maintain that childcare room, that can have huge impacts on your bottom line. And people don't really see what those true operational expenses are when you're looking at childcare programs. For childcare centers, infants lose money. I have not done a financial analysis yet where an infant room is even close to breaking even. I see them $15,000 in a hole, $20,000 in a hole on a regular basis, regardless of where that childcare program is located. It is the most expensive program for parents, but it's that 1 to 4 staff ratio. So every 4 infants, you have to have 1 teacher or an additional staff if you have more. So it's that staffing piece that can increase that can have an impact on that classroom. Toddlers, I've seen a lot of toddler rooms not breaking even or really close to breaking even. Some I have seen either breaking even or a very small profit, but again, that's not going to do any help to your bottom line. And it depends on how they're staffed for childcare centers. It's a 1 to 7 ratio. That's where a lot of children are learning how to use the bathroom and biting and hitting and learning to share toys nicely. So I don't know about you, but I have 3 boys. I could only imagine 7 toddlers in one space with 1 adult. You may be feeling like you're ganged up upon because it's a very difficult, challenging age as well. Where childcare programs usually earn a profit, and it's for both family and also centers, is that preschool age bracket. And there's a lot of other additional preschool programming that parents have to offer. And so that preschool program is what's going to float the entire program. And also summer school age programs, especially for childcare centers. And so if you're looking at an area that may have a lot of other preschool programming and activities, your childcare center might have a lot more struggle financially because they don't have the volume of kids. When we're looking at childcare centers and we do a lot of financial modeling, there can be a sweet spot depending on costs of care, depending on what you're wanting to pay staff, depending on operational expenses, but it's around a 75 to 100 seat center where we can kind of start to see that financial sustainability piece. And again, there's a lot of variations that can make or break that. And so in rural communities, they don't have the population density for a 100-seat center necessarily. And then for family childcare programs, when you're looking at childcare, what the cost is, on average, they are earning about $15 when the last time we analyzed our information. It's about $15.46 an hour. That's pre-tax, that's working 65 hours a week. And so it really depends on how their business is ran, but it can be also a very challenging business model for them.
Thank you. Assistant Commissioner Brown, could you maybe just catch us up on a little bit where things are right now in terms of what actions have been taken recently, to help families and childcare providers with addressing this, or maybe if there are any potential policies on the horizon to try to address it?
Sure, thank you. So we had, I should give just a big shout out to advocates, providers for telling their stories, community groups coming together across the state. I think what I've learned I've been an assistant commissioner in this role for about 2.5 years, and certainly the child care space, there has been just a really great coming together to help educate folks and share information and tell the story of what exactly is happening, and how people are being impacted. So I think sometimes a lot of the legislation that we see that has really come to fruition in the last year has been the result of decades in the making. So I just want to shout that out, that that's been incredibly important. So this last legislative session, we had a number of bills that passed that really will make a big impact. Now, this is the hard part, right? We're still seeing some of these being implemented, so the wheels can turn somewhat slowly. But one of the biggest pieces that I think is incredibly important is the child tax credit. This will cut child poverty in our state by 1/3. We are the first in the nation to have a permanent child tax credit, and that is just beginning to be implemented. We also were able to pass a statewide paid family medical leave insurance program, which has that partial wage replacement for up to 12 weeks of leave. Again, incredibly important for the context in which folks are operating within. Within the child care assistance program, we were able to increase the rates to the 75th percentile of the market rate. And so this allows us to really adjust according to a market rate survey that occurs every 3 years. We had been attempting to do this for a number of years, and we're really excited to see that pass. We also had investments in the basic sliding fee CCAP program by $38 million per biennium, which really increases access to families, up to 1,000 children, we estimate. I'm going to just keep going down this list because it's incredible and it's a lot, but I think it really illustrates the really big wins that we saw this past session. We have funding for the development of the implementation plan for the new Great Start Scholarship Program, and that integrates administrative and funding structure for early care and learning programs, which is really trying to address that childcare cost of 7% of income, right? So we're at 21% now. I think folks have made it really clear through some panels and through some reports and through, again, coming together, that 7% is where we want to try to get to. So that helps us get towards that effort. And then we've centralized and streamlined our child care assistance program, or CCAP, provider registrations and renewals. So trying to get at the piece that both Sherry and Marla addressed, which is that business aspect of the work, really trying to create some efficiencies on that side, replace some of the duplication efforts. One of the things I was shocked about as I came into this role is the amount of paper that we are still utilizing in 2024, right? And so a lot of the efforts that have passed the session are really trying to improve us and bring us up to speed on the technology aspect. So I can go on, but there's just been really a huge amount of effort and investment in the system over this past year. And yet we still have a ways to go, right? I was really privileged to be able to attend a rural community childcare gathering in Ortonville in September that Kids Count on Us held. And so really had the opportunity to hear what business owners were saying, which was that similar to what has been shared, right? That they cannot fill vacancies in their businesses in rural communities because they don't have the childcare spaces. So they can get somebody on board, and then they've even shared stories where they went through the training and then just couldn't get the childcare and had to leave that position. So they shared how much they were hurting on that side. And then I also heard stories of folks having to travel an hour away to find a childcare center, and just the strain that puts on families is really immense. And I don't think we can discount how that impacts communities. Also, I think just outlining and highlighting what folks have shared, that a one-size-fits-all approach does not work. And we're really trying hard as we look to the future to make sure that we are really trying to diversify our resources, our supports, and the services that we can provide, so that just recognizing, you know, one rural community looks really different to the rural community next door, and we can't have a one size fits all. So as we look to the future, I'm almost done here. We are looking at some of the examples that folks have shared about the Child Care Stabilization Grant Program, right, where we're looking to build upon some of those pilots that we saw, increasing compensation, trying to raise that minimum wage that we have of $14 an hour across the state. So what more investments can help lift that up? And then we also are looking at so something that was shared earlier about access, right? As we look at the childcare deserts, if you will, and really recognizing again, how can we address folks in their communities. We do have a new I guess program that we've added, which is equity access areas. So we are increasing payments by 10% for folks that are in certain communities that are really having access issues. And so that there are some in the metro, but the majority are in rural communities. So again, just really trying to be thoughtful about our approaches and trying to address some of the needs that have been addressed, both longstanding, and then now that we have some of these baseline supports in place, we have to implement all of those, of course, but then also look to the future to see where are the gaps and where do we need to continue to work.
Thank you. I want to come back to a question that was asked a little bit earlier in the chat. Someone, Holly asks, what is the likelihood that the food program reimbursements will increase, or how likely is it that childcare centers could get free lunches like Minnesota schools? Has there been any talk or lobbying toward this effort? I don't know if anyone knows anything on that. I wanted to make sure I asked it.
So I don't know who can speak to that, but so that is outside of the Department of Human Services. So unfortunately, I can't speak to that program specifically. I will share that this has, in some of the conversations I've had as I've visited providers, they have raised this as an issue that they would love to be addressed. So I'm just echoing what has been shared, and certainly something to work on. Would welcome any others to speak on it, though.
The food program is through the USDA, and it's a federal program. And so those can be difficult changes. There have been conversations on it. I know that First Children's Finance have sat at the table to talk about it, but yes, that is a federal program, so it's a little bit harder. Minnesota can't necessarily adjust the federal food guidelines. I don't know about the free lunches. I can't talk about that as well either. But yeah, the federal food program is challenging. And it is one of the largest budget items for childcare programs, and inflation with food. Little people eat, and it's expensive. And it is a very large budget item, and the food program is always encouraged, but you know, there are challenges. If you are a for-profit childcare center, then you have to have a certain population of your children in that free and reduced, in that income bracket to qualify. So there are challenges there when you're looking at for-profit, nonprofit versus family childcare programming, and if they qualify for the food program.
And I just want to say, food is not where you can cut back. You can't. I can cut back on my paint or my, other things, but that meal might be the only meal that child is getting. And I can provide that meal. So food, you cannot, that's one spot. It's a very expensive line item in a family childcare program. I know it is in a center too, but that is one place you absolutely cannot cut back on. I have children that when we get an early out at school, and even though they've had lunch, the school age kids will come in and say, it was a cold, quick lunch today and they're still hungry. So then you create lunch for them again so they can eat, so their tummies are full. It's one of the most important things we can do for them.
Marla, you mentioned that you, like many centers, have trouble with staffing, that's been a big challenge. Does it concern you if things continue the way they are now? That would you be able to stay open if things did not improve, if the way things are now?
I'm sure we'll be able to stay open because I believe things will improve in staffing. We all need to go out like to the colleges and put flyers out in the colleges to get staff to come in that want to be working in our field. That's the difficult part, finding staff that is qualified and want to be working with the children.
Thank you. Larry, could you, Marnie mentioned this a little bit off the top, but can you just explain how is the childcare crisis really impacting the workforce and the economy? Because this is not just a childcare issue, it is a whole economic issue as well.
Yeah, this is absolutely an issue. My prior life before coming to DHS licensing, I was business development director for the Greater St. Cloud Development Corporation. And working with our employers, it was a constant narrative that finding employers and finding employees and making sure that employees have access to childcare is one of the biggest barriers to onboarding a new employee. And this is something that we hear anecdotally as well throughout licensing. We work with, somebody mentioned the pod daycare model in the chat. We work with employers, we work with centers and family childcare providers to try to get them up and running. On our family childcare, on the childcare center side, in which we directly license, we have an early and often program where our licensors work with childcare centers in their first year and provide intensive technical assistance and work with that provider to try to get them up and running. For family childcare, it's a little different because it's a delegated system to the counties. So the counties are in charge of carrying out the licensing regulations at the local level. And oftentimes you can get, as we know, with 87 different counties, 87 different approaches with exactly how the local licensing agency might work with that individual provider. But it is making sure, especially in rural Minnesota, making sure that you have a safe place to drop off your most prized possession, your daughter and your son, and being able to go to work is one of the biggest barriers that people are facing.
Katie, can I jump in with a little more stats too? When you're talking about childcare and the local economy, every year we do a supply demand gap analysis. You can actually find the data on our rural childcare website. If you just Google ruralchildcare.org, it's actually ruralchildcare.org. You can go to and see it. We break it down by zip code on what that potential need is. And we're looking at childcare programs that offer 12-month wraparound care. We look at children under the age of 5, and we also look at with all parents in the workforce. So that potential need is like a dartboard, right? It could be a little bit larger, a little bit smaller, depending on your community. But if you're looking at just the Minnesota from that data, June of 2022 to June of 2023 is when we actually do the analysis. Minnesota experienced a net loss of 320 childcare programs. The year before that, it was over 500. So, I mean, it's that steady decline. Through our community work, we do a lot of surveys. And so, and analyzing the surveys. So in 2022, when we look at all of our communities that have gone through our Rural Child Care Innovation Program, 55% of those survey respondents said that it had an impact of family planning. So these are parents that are choosing not to have any more kids, choosing when they're having kids, based on just childcare challenges. That's a huge number. 55% of parents are saying that it's affecting their family planning. 35% of parents withdrew from the workforce. That's 30. That is a large number. When we talk about local economic development, 35% of your workforce is leaving because they can't have access to childcare. Especially when the state of Minnesota, 71% of the workforce has all parents in the workforce. So we have a very high percentage of parents, of all parents in the workforce, and 35% of them are withdrawing or declining employment because they can't find childcare. And then when we look on the employer side, 47% of employers said that the lack of childcare has impacted their ability to attract, and 45% that it had the lack of availability to retain their employees. And so we really look at, on that community level, that economic fabric. It's a three-legged stool. It's housing, it's workforce, and it's childcare. And we really bridge that. So it really doesn't matter if you have kids or not. It's a really value to your community to be able to access childcare for your families.
Jessica, I wanted to follow up a little bit on something you said in there about the percentage of families that were taking childcare into consideration. If I think you said if they would have kids or not.
Mm-hmm.
You know, we talk about the birth rate and things like that, and a lot of factors in that. But do you see that if this is not addressed at the rate that costs continue to go up and the shortages and the staffing challenges, will we see that continue to be a problem? Because there are people who don't have children or aren't in that phase of life yet. Why should this still matter to them?
It really should matter to everyone. I mean, if you have people not having children, that's going to affect the future growth of your local economy, your future growth of your school districts, future job implications for all local employers if there's fewer and fewer bodies to choose from. We want to maintain that stable environment for our communities. And it's something to think about.
And I'm sorry, I meant with the childcare crisis specifically, but yes.
Oh, yeah, sorry.
Yep. No, agreed. Thanks so much. Sherry, maybe could you also touch on, I know there's a lot of coming in through the chat, so I'm trying to read it as we go. Someone had mentioned, the different types of childcare being explored to try to help in the situation. And someone brought up pod daycares. And I know, Sherry, you've tried this, or can you explain a little bit about what you've seen?
I guess we call it affectionately pods. Grouping family childcare programs, trying to figure out how to make it work, working with the state with a special license. Larry touched on, maybe possibly some other things in the work of being creative in licensing. So Stevens County has been in, a critical shortage of childcare. The university is having a hard time getting professors. The industry here cannot get workers, quality employees coming in. The ones with families are worried about their children. They can't work when there's no childcare, or they're worried about what's going on with their child during the day. I get calls a lot about, we're moving to Morris. Do you have any openings? And I know we're already in trouble because I'm the end of that list for our county. And I'll say, no, I'm sorry. I don't have anything. I have a waiting list, but don't count on it, but I can put you on there. And they're so desperate. So then they don't come here, and our economy doesn't grow. It affects our school district, everything. I mean, childcare is part of that economic foundation. So the county commissioners, we got ARPA funds, and they decided to take those $1 million of those ARPA funds, and they stepped outside the box, and we created, I was on the committee, they asked me to come in for childcare. It was, a variety of community members, a couple county commissioners, our county administrator, Becky Young, was on there, and we decided to build 6, what we call the pods. It is a single family apartment with a large great room, a full kitchen, a full bathroom, and a full bedroom, so that it met the food program requirements. Because a lot of times if you're doing childcare outside your home, you can't get the food program. So we met with them. This is the requirements. Licensing was awesome. We met with them and said, what do we need? How do we do this so that The facility itself was going to meet licensing standards. All we had to deal with was getting the providers through their licensing process and getting approved that way. The beautiful part of this is the community came together. A lot of times we just paid for the materials. The labor was donated. The county said they're going to, you know, they will, well, I can't specifically say exactly what it all was because it's much more involved than what I can explain here today. But we have 6 full programs. It's set up for a capacity of 14 kids each one. The possibility of creating those new businesses coming into town was helpful. There's places for kids to go. We had a shortage of about, I want to say around 200 slots in our county. And those 6 pods or those 6 programs have a possibility of filling between 70 and 84 slots for children. Obviously, the infant numbers are a little bit smaller because you can only have so many. But, you know, what happened was a lot of these programs coming in had an infant of their own and they could not find anywhere to go. So they're like, well, if we're going to stay home, let's do this. And so we have got really strong programs. We interviewed them to make sure that they were a good fit. The county is only the landlord. That's their only responsibility. They pay $100 a month rent and they pay their utilities. That's their commitment to the program. The county put up fencing there. If you drive by there ever, it's Old School Lane. If you ever come through Morris, drive through there because it's kind of cool and fun to see where the 6 pods are lined up. They're all, you know, like if you can imagine a strip mall. And then behind that are 6 individual rainbow units. So it's colorful and beautiful and the kids love it. And then there's a big space for them to go. We provided a shed for each program so they have somewhere to store their materials. I just want to say our county commissioners stepped outside the box. They didn't have to do it and they took the chance. And I have goosebumps. I'm finally part of something that works. It's finally something that was successful and families are excited that they can have their children together in one program. They also took that ARPA funds and they said to the existing programs here, here's $4,000 in grant money, fix your program, find a way to, you know, sustain your numbers. Do you need new egress windows? What do you need? Like, what do you need to fix your program, the facility part? And they did that for us too. So I feel like we're pretty stable. There's still a shortage of spaces, but this pod model was interesting. We started out with meeting with providers and the center that's here. And then we met with the community. And once everything was established and up so they could, you know, people could see it, we did a meeting for committee members and other communities working on it. Licensors came. I mean, it was a wide variety of people working within the system that wanted to see how it was. Now we have the blueprints and you don't need to reinvent the wheel. Get a hold of Becky Young. She'll share anything with you. If this is something that would work in your community, she'll give that information to you about how we did it. And, you know, maybe you can adapt it for your program, but it's a success, you guys. I'm just so excited that it went the way it did.
That's great. Thank you, Sherry. I'm going to throw this question out to all of our panelists and whoever feels maybe best to respond. But, you know, the Interconnected series looks at, you know, both issues happening in greater Minnesota and here in the metro, certainly childcare, that's the case. Why is it so important to recognize that the issues facing childcare in rural areas in Minnesota are different than the metro? You know, can you really address this with a one size fits all? Why is it so important to recognize that their issues are different and treat them differently?
I don't think you can address any community as a one size fits all approach. It doesn't matter if it's in the Twin Cities metro area versus rural communities. You want to have that right size solution, and you want to be able to look at what does this community look like What does their workforce look like? What are their top 3 industries in this community? What is that potential need? What is the percent of infant toddler versus preschool? What kind of other preschool offerings that might not be licensed available in your community? What kind of community resources are there? Those are all the things that when we work on a community level, we kind of work through community by community. It's no different in the metro area. The solution might look different. Their market rates are different. The number one issue besides staffing for childcare centers is facilities. Finding locations that are available and built for childcare. Childcare needs a lot of water and bathrooms and plumbing. So you want to be able to think about what is that approach, you know, communities in the metro, you might want to look more on that neighborhood. What is the type of cultural communities that are surrounding my program? What is the businesses around in my program? You may be able to have more centers in the more metropolitan area because of the volume of children and population base. And so that's where that pod model or that opportunity to have multiple family childcare co-located in a single space, which can look very different. We worked with communities on what that looks like. What Stevens County looks very different than, you know, what is in International Falls or in Hills, Minnesota, or all of that. But it's what is that community input? What does the population look like? What are the cultural and linguistic needs for children in that community? So I don't think it can ever be a one size fits all approach, no matter what it is. The size and scale may be very different based on more of the metropolitan areas than rural.
Great, thank you. Assistant Commissioner Brown, could you talk a little bit about what collaborations are being explored with organizations to try to improve childcare access?
Yeah, thanks for that question. I mean, I think Sherry laid it out so beautifully with that pod model. And I'll put in the link, a resource around childcare facility revitalization grants. That's also a good resource that Children's First Family Finance can also speak to, as I'll just put the link in there, but also just a resource to really help around the innovation and thinking differently about how might we meet the need. Other partnerships, you know, as we look for, one of our ways that we do that is we look for different pilots across the state, right, that we could lift up and then create investments for, and then hopefully become legislation and become standardized across the state. One piece that I think is interesting is there's been a lot of work around trying to address Marla's issue around staffing and around different pools of people that might be able to travel across a region or an area as, you know, substitution pools. That's something that we see that might have some great promise that could become something that is permanent across the state. Another piece that I wanted to address too is our family, friend, and neighbor childcare program. Folks don't always understand that they might be, you know, in that sort of criteria. I saw that there was a question in the chat about, you know, what about those individuals who might be a grandparent or a neighbor that's offering childcare and they're not licensed. And so we're really trying to partner with those folks, help educate them so that they can become licensed and then become part of this larger pool of resources available. But we continue to work with so many different people that I can see on the chat and, you know, on the panel. You know, we need additional support that Jessica so, you know, greatly shared around data. What is it that, you know, what is it that our state is doing in terms of trends? And so working with Child Trends, working with the University of Minnesota and Wilder Research to really help elevate all of the stories that we're hearing and then put some research around it so that it becomes more real for some folks that just need that a different way of framing so that additional legislation support and resources can be provided. Thank you.
Thanks. How can people who are watching or people who see this webinar, once it's up online, what should they be thinking about or doing to help? Can they do anything to help be part of the solution? I'm sure Marla would say, go work at a childcare center, would definitely help. How can people help with this crisis or be involved in being part of the solution?
I'd like to interject a little bit and put a plug in for our regulation modernization project that the department is undertaking. This is a multi-year project, and one of the items that we're working on is revising our licensing standards. And that's both for family childcare and childcare centers. We're almost 40 years old. When these regulations were put into place, you could smoke on airplanes, and the world has changed substantially since then. And one of the things that I hope everybody here in participating, we know that you care about childcare and how it's impacting the industry. And I would highly encourage everybody here to reach out to our modernization website, sign up for our listserv. We will be releasing a draft set of standards that will be open for public comment either at the end of March or beginning of April. And this is a draft set of standards. We're really looking for your feedback and your input and your perspective. When you mentioned about trying to, can you regulate to a one size fits all? We absolutely know we can't do that. And when we try to put together licensing standards, we have to approach it with a broad lens, but try to have systems in place in which we can be nimble and flexible, so we can leverage that innovative thinking that was discussed in Stevens County. And making sure that our systems have that flexibility. So I would really encourage you to continue your participation in events such as this, to reach out to us and to provide your feedback when we do have that new set of standards. And that will be imperative for us, hopefully having a modern set of regulatory standards that reflect your needs and the realities that you're facing every day in your work.
I think it's important too that as we address this shortage and we talk about the challenges, and it's great to have, resources come together and from different communities, different cultures, because we all have unique needs to share information. But I think the most important thing we need to know is childcare is not for everybody. We don't need a warm body to fill a hole. We need somebody who has a desire to learn about child development and meet the needs of those kids and families, and they're, helping them meet their milestones. You need to make the right career choice. Just because you think you can make $5 doing this, you're not going to make it. You will not make it. So, and it's hard. There's ebbs and flows, and there's burnout, and there's things you need to work through professionally, and you need to do training and work on quality every single day. Families and children deserve that, and the people in the programs deserve that. So I do want to put a shout out to the Teach Scholarship. When you do family child care, I can only speak from family child care. Marla, if you know more about it from the center side or somebody, please bring that in. But as a family child care provider, I used the Teach Scholarship, and I was able to finish my degree in child development. I have a 4-year BA in child development. It changed my program. My kids have a different experience now because I know more, and I'm excited about it. And it's very affordable from the family child care side. Get a hold of them if that's something that, if you're a family child care provider, use that resource. You probably won't find that anyplace else, but I don't know if anybody can speak from the center side or not. I don't know much about that one.
I would say there's a lot of resources available for providers and programs, if it's through scholarships, childcare, where our office can help with programs that may be struggling on the business side of programs. We have a variety of grants. We also are a CDFI lender for childcare. Our portfolio is only for childcare programs. So there are a lot of resources. If you're in rural Minnesota, a lot of the initiatives have dollars and resources for childcare programs. So just kind of be aware of those resources, talk to providers. If providers are struggling, help them find resources available, point them in the direction if it's the childcare aware or First Children's Finance or whoever it may be. Think about maybe going through one of our community engagement processes. We have our Rural Childcare Innovation Program, which is an 18 to 24-month process, but we do work on a much smaller scale with communities too, with a strategic supply plan or other community consultations. Many of the communities that were mentioned here, or even in Marnie's presentation, were directly tied to some of these community processes. So that's a cross sector of communities to really understand the childcare need, the challenges, why is it so hard to maintain financial sustainability, what different ways communities can help leverage their resources on a local level. And then I would say your local legislators.
Can I just pop in one more time too to say we can't forget about our ombudsperson. It's a new position that's there now. That's a resource for family childcare providers. If you need to bounce off an idea or you need to help somewhere, that office is available to us now. That is something new. And I don't want to forget childcare aware because they're always an asset. Parent aware coaches are so invaluable. And so there are resources out there that we can reach out to. You just need to know where to go to get some of those things too. Anyway, so.
I'll just jump in real quickly too. I just think it's such a lovely lift up that Sherry has provided around really illustrating the importance of the provider, right, as a human, but also just as worthy of a higher wage, worthy of all the investments, and just highlighting that it is a business, right? It requires a full complement of supports to really make it worthwhile. And we can't forget, as we think about the big picture, we didn't get here, as we saw from the charts earlier, we didn't get to where we are at overnight. It's been a slow and steady decline. And so it will require not only the investments that we have made and the advocacy over the past, many years to get to where we're seeing some really, a good trajectory and upward progress, but that needs to continue. And I think what you've uplifted, Sherry, and others really illustrates the importance of that. So thank you.
Marla, I saw yours went on. Did you have any last thoughts, or
I just wanted to say that I too use Teach to get my CDA, and I continue to give that information out to my staff if they so want to use that to get their CDAs. That's all I wanted to say.
Great. Thank you so much. I'm seeing lots and lots of comments come in. So all very meaningful, real challenges that people are dealing with in their centers and in family childcare providers throughout the state. But good to see that discussion happening. With that, I want to be mindful of everyone's time. I have only a couple minutes left. I'm just trying to scroll through our chat. I'm not seeing any new questions. So with that, I want to make sure I thank our panelists. All of you I know are very busy. We so appreciate you sharing all of your information with us. Thanks to the Center for Rural Policy and Development and Citizens League. Thank you to everyone who attended and is leaving your input, or if you asked a question. Please do keep an eye out for the recording. As Julie mentioned at the beginning, you can also check out the center's research and events they are doing at ruralmn.org. And also keep an eye out for the other interconnected topics. Have a great day.